And I'll hand over to Mark.
Wonderful, thank you so much. And firstly, bear with me, just got a message. Firstly, just to apologise, I'm clearly not Kirsty Baxter. Kirsty's unfortunately had to attend a personal appointment at very short notice, so I am standing in for her. I work in Kirsty's team and have worked in HE for a number of years. And I'm here. I noticed the title of the session was Workforce Wonders. I don't want to disappoint you, but I'm going to be talking about workforce redesign as one of the many workforce wonders that exist, and just give you a bit of an overview of some of the activity and work and views we have in HE about workforce redesign. I think, just as a quick aside, you'll notice that I work within the workforce transformation function, and I'm talking about workforce redesign. We do have kind of discussions around workforce transformation and the grandiose nature of that term. It can be used somewhat, can feel a little bit uncomfortable at times, if I'm honest with you, in that really when we're not looking to transform the NHS workforce, we're looking to do things differently with it. But what we've got in the health and care workforce is really solid and strong foundations in terms of skills and roles that are already in play. So just got a bit of a caveat around that in the first instance. So bear with me, sorry. Right. Firstly, I just want to kind of put workforce redesign into context around planning and what is often described as workforce planning. This is a slide that we've produced as an organisation, which very much takes on board and addresses the role that integrated care systems and the new integrated care boards are going to have to play in the kind of system-wide workforce planning space. We very much often, when we talk about workforce planning, very much focus on the use that phrase to articulate our desire to capture and understand what workforce supply is and marry that against service demands. What we find within our work in workforce transformation and workforce redesign is that we're very interested in the work that happens. If you can see, you probably can't see my cursor, but point 3 here, where you create the all levers action plan. That's the space through which you start to synthesize, understand what the issues you've got are within your service, start to think about the competencies and capabilities that are required, and have conversations and engagement with colleagues, and this is very much where Claire comes into the picture, around what's needed moving forwards. I think it's also important to understand and appreciate that workforce redesign or workforce transformation needs to take place in that broader conversation around service delivery and service redesign as the starting point. If we're trying to crowbar workforce redesign into and in response to knee-jerk problems or problems that you've got immediately, and you don't look at that, what's needed within your service, you're going to come unhooked, and I would argue probably not come up with truly sustainable and impactful solutions. Okay, I can't see comments and questions, so I'm going to just gently plow on, and we'll come on to those at the end. So some of the things that we're what's really important to us within the transformation team within HEE, and important to everyone with working in support and alongside the sector, is about producing resources and tools which are accessible, simple to use, and simple to understand. That's absolutely key here. I think the whole world of workforce planning and redesign can seem very, to those not involved in it, can seem very confusing and a specialist subject. Now, without that specialist subject, I'd have to reconsider my career choice, but we do need to make it really, really easy to engage with. And, as you all know, working within the sector, there's a lot of pressure on individuals, time-wise, what's happening within services, and it's beholden to us to produce resources and tools that are easy to use. Now, some of the resources that we developed or we commission and work with are clearly clear. The HEE Star, we've got a multidisciplinary disciplinary team toolkit, which is new and just recently launched. A roles explorer, again, new and recently launched. The importance of using spread and adoption methodologies and understanding the best practice around that is really, really key. And I'll come on to that, all of this in a little bit more detail. And we've also got some kind of COM-B framework, which is a model very much looking at the psychology of change and focuses on a model of behavior, looking at capability, opportunity, and motivation as three things that its focuses on. And that's a piece of work that we in the National Transformation team here in HEE are putting some capacity out into our regional teams around, and that's something that will land and get underway over the next few months, and we'll have a good run at that for a couple of years in terms of bringing that support into play. But if I move on and just talk about, I guess, our default methodology, HEE's default methodology to plan workforce-related improvement, which is the HEE STAR. It's a couple of things. Most importantly, in the first instance, it's a OD methodology through which one can drive better understanding on the solutions for a particular problem, utilizing 5 key enablers. And you can see on our lovely star diagram here that the 5 key enablers are supply, upskilling, new roles, new ways of working, and leadership. And effectively what we've been doing is utilizing this methodology to run workshops. And what you could do is take an example of one of these projects here. You've identified an issue that needs solved. You need some greater clarity in terms of resolving. You pull together your key protagonists or stakeholders into a room. You use an expert facilitator on the STAR methodology, and we work through over a few hours how are you going to address that issue? And using those 5 key enablers gives you a really structured conversation through which you can start to understand what the issues are. That we find that incredibly helpful. And one of the things we're doing is building capability out in our regional teams and out into integrated care systems through a training program to really upskill people. So we're getting really good take up on that, despite the fact that everyone is incredibly busy. I mean, there's a real recognition that, the supports and tools to resolve workforce issues are incredibly important. It is also an online repository of information, where useful tools, case studies can be accessed under these headings, and there is a link at the end of the presentation to it, and it's very interactive. It spins round and everything, and you can look under supply in hospital and find a variety of resources that can support you there. We've made it very straightforward and simple, and we're adding to the resources as more work takes place. I will move on. I'm currently working on a significant program of work called Elective Care Recovery, which I'm sure pretty much everyone who's working within the health sector will be aware of in some shape or form. We know that there are significant issues in terms of accessing services for patients and service users, and which have been completely magnified by the impact of COVID and everything that's brought with it. And we're working in support. We're working against 3 priority areas, but there are many other regional priority areas. We've got eye care, MSK, and cardiology being the ones that are 3 national priority areas. And looking at a kind of wraparound package there. And we're doing some work within Sussex around eye care. And I've just brought this slide into play to just kind of give to demonstrate how we work with a system in terms of supporting them and managing that workforce conversation. We've got the CLEAR team doing a longer term piece of work around clinical stakeholder engagement, utilising data to drive conversations around what's needed, where the bottlenecks are within the service, and what some of the solutions are around that. I've grossly oversimplified, Claire. I do appreciate that, but yeah, I haven't got the time to go into the detail there. We've got the importance of that data analysis, what I described earlier as the workforce planning piece. What's the workforce supply and service demand issues, and what's the intelligence that's giving you, and the intelligence that's giving you to inform your conversations around what your workforce needs to be moving forwards. Okay, so that's hugely important. We've got STAR workshops. It doesn't need to be 3. It could be 2, 1, 4, 5, or any number. But those STAR workshops are very much used to identify the how. So if you've got a particular issue, like I said, how are we going to resolve it? And you can use those at particular stages in your process to really kind of, you use it as part of stakeholder engagement, frankly, as well. So, but as well as driving solutions. And another piece of work we're doing within this particular example is competency and educational pathway mapping. So once we've articulated what the service pathway needs to look like, doing a piece of work and understanding what the competencies and capabilities are to deliver that, which will help inform solutions potentially around upskilling or what roles to utilize where. And appreciate there's a good healthy debate and tension around working at top of the scale and what roles and competencies we use, and debates around denigration of role and loss of professional identity and all of that, and that's all entirely valid, but that's a really helpful part of the process, and what we're testing about how we kind of arrive at some fairly quick upskilling solutions, frankly, in the first instance. And finally, we've got repository and playbook and implementation. It's a piece of work I'm doing, which is pulling together a repository of information around eye care, for example, case studies, best practice, evidence briefings, that people can dip into when they're looking to try and resolve some of these issues around elective care recovery, as well as the playbook being the resources that we have collectively to drive and implement some of those innovations that you see in the case studies. And implementation is a key thing, which is very much focused around getting the capacity and the mandate to drive change, and where we see people don't have that mandate or haven't been given that mandate by senior teams, for example, that can be very hard to progress pieces of work. I'm aware of the time, so I will gently move on. I've kept this slide here. I'm assuming colleagues will the slides will be available to colleagues if they wanted them. Yeah, okay, that's fantastic. I'm not going to spend too much time here. I've talked that through, but what we've done is just given a bit more detail around what each of those different interventions on the previous slide do, and some of the outputs that they arrive at. So I will gently move forward. We've released and launched 2 additional products recently. One is a multidisciplinary teams toolkit, which is available on our website, and there's a link on the slides here. And it's an interactive online toolkit to help teams, organizations, directorates really explore what it is they could be doing to work more effectively as a multidisciplinary team. So, taking that premise in mind, which is we can always learn and improve things, we've got the toolkit does provide, there's a kind of an analysis, a kind of review questionnaire, so you can as a team kind of take stock as to where you are in terms of how you behave and work as a multidisciplinary team. And then we've got 6 enablers which are gone into a lot more depth with ideas and papers and resources, where you can start to understand the sorts of things that you could be doing to become more functional. That maybe not the right word to use, but we've done a lot of work here in terms of literature searches, taking ideas and evidence from other organizations and think tanks and brought it into one place. I find the kind of final offer that we have at the moment is the Roles Explorer, and this is an online within NHS Futures, which we know is used very widely, an online resource where we are putting together roles within a particular service. So, for example, we're going to pull together the roles within eye care. We've got someone on mental health, and we've certainly got someone in terms of the reimbursed roles in primary care. And it's a one-stop shop where you can have a look and see what the roles are, what's required of them in terms of educational pathways, and it's a step on the journey to developing a career framework, but it's a hugely important piece of work. This and the multidisciplinary teams piece very much came out of and were mandated on the back of the people plan. So these are things people have been asking for, and we're developing and putting out there. So I'll just wrap up in terms of my last slide. We know that we've got the HE Star and Clear. They've both had some evaluation recently, and we can see that there's some really good added value that both these processes and tools bring into play for people. But I think what we've also got to be is introspective, and we do know there's a lot more work that can be done across the sector around evaluation with regards to workforce. It can be difficult to identify cause and effect, but we're working very hard in HEE in terms of a lot of the work that's going on nationally and regionally to really hold that evaluation lens up so that we can share learning. We can demonstrate impact, we can assure ourselves of best value for spend for public money, but there is work to be done there. But also improving ourselves in terms of spread and adoption. We do have a spread and adoption model within HEE. There's one that's recently been developed and released by NHSEI by NHSEI, and I'm certainly taking both of those models and really underpinning the elective care work and the case studying, the repository of information that we're producing to really kind of strengthen our approach in terms of spread and adopt, because that's a real key challenge when you're working at a national or a regional perspective. But also what's really, really key is, as I said at the beginning, designing tools and providing tools that providers can pick up and use with support from their teams. And we've hopefully demonstrated that we're responding to the need that's out there. We're trying to articulate how they interact in a kind of cohesive way. And we feel we're making some progress, but there's a long way to go. But the engagement with people like yourselves, that should be made a lot easier. That's me done. I'm more than happy to take any questions.
Thank you, Mark. I'll open it up to the audience if there are any questions. Yes, Jason, if you wouldn't mind coming off mute.
Hi. Yeah, a question for Mark around, there's a couple of questions actually, Mark. I thought that was really interesting. I'm becoming increasingly interested in Clear locally. There's been some systems locally that have kind of identified it due to its kind of clinically driven methodology, really, around how they might embed it. Now, we've done some outline costings locally, and it's quite an expensive thing to get off the ground, really. And it's about how that needs to be supported locally, how we can sort of bring about that funding, which I understand potentially comes from multiple different places, maybe potentially from the system, NHSEI, and so on. I guess what I'm interested in is, do he have a vision, or are they working on a vision for what a kind of regional Clear faculty might look like? Because what I'm building in my head is this kind of vision of having a regional faculty that's made up of potentially NHSEI transformation teams, HE transformation teams, and actually developing Clear practitioners actually in the systems, maybe clinicians that can be picked up and pulled around to solve different problems. So if you like, you develop a faculty of Clear practitioners with the skills that can just support any project. I just wonder if there was a direction.
Happy to answer that, and also hand over to any colleagues in the Clear programme if they wanted to add in on that. But certainly that's one of the things I was speaking to Kirsty about and colleagues as we do the elective care recovery programme, Jason, which is very much what all the initiatives that we have, both Clear and STAR are very much predicated on a building capacity, you know, so they are models that go out there and teach people and provide experiences to learn as to how to support this methodology moving forwards. So there's a legacy there which is enduring, which creates impact. And the spread that of the clear, and I'm going to use the word pilot, I'm not sure if that's exactly the right one we use, but the sites and that we are commissioning utilizing clear, I've been doing quite strategically in particular geographical areas as well as across different service pathways, and able to do that. I wouldn't see, certainly I've had a conversation with John around the kind of regional faculties. It sounds like an eminently sensible idea to me in terms of, you know, creating that model through which you bring interested parties and practitioners as they've been trained in terms of using it together to share practice and actually to build other ideas, models, tools that different organizations can bring. So, you know, I've talked about the HEE offer there, but, you know, even within our regional teams, there are other approaches that are used in combination with some of the stuff that I've talked about. You know, there are many workforce planning methodologies. There are many different approaches to bringing people together. And it's important that, you know, I would be creating, whether or not that's a community of practice or however you describe it, a faculty, Jason. I think that's an incredibly sensible idea. I'm not sure if anyone else wanted to add anything into that from the CLEAR programme.
Yeah, if I just quickly jump in, I think that's, thanks Jason, something we're definitely investigating as part of developing the CLEAR programme, so people do have access to it. And maybe if you'd like, if you send a bit more detail of your region and some of the transformation ideas or thoughts that you're trying to achieve to this generic CLEAR inbox, I can pass it on to somebody who's probably bit better versed at answering the intricacies there.
Thank you. That's great.
Thank you, Jason.
Any other questions from the floor? If not, I had one, Mark, if you don't mind.
No,
so you mentioned about creating these repositories that people can access, particularly one in ophthalmology. And as the NHS is moving towards a bit more of a place-based, patient-focused way of giving care, I wonder how generic you can be in that repository and any experiences that you have in creating it.
I think it's there's a danger of being generic, isn't there? Because the stories don't resonate enough, and I think that's one of the things that comes out of spread and adoption models is a lot of case studying tends to focus on process as opposed to benefits and then the individual concerned. And there's something about telling compelling stories, through which articulating the benefits of the piece of work and the impact on the individual, whether or not that's the individuals that are driving the initiative, or as more importantly, the individuals on the end of the care is important. I think there's going to be a challenge there, and I'm just drawing up a bit of a plan around this. But because it's place-based, it would be great to have stories that are place-based, which spark and give people ideas. I mean, there are different levels of kind of learning that people take away from case studies, either on reflections of the key learnings that happen within a particular piece of work, or just that's a good idea, perhaps we could try that and start to think about it. So depending on the individual's maturity who's reading it, they're going to take different things away, which I think provides a bit of a challenge in terms of sharing intelligence and information. But I tend to work on the basis that busy people, what you want to do is give them enough information and know where to go to ask some more questions as well. So I don't know if that answered your question, but I think certainly those are kind of the thoughts that are going through my mind, and looking to kind of add value. I've pulled together a bit of a reference group around this. I'm just meeting on Friday, so we're going to explore a little bit more about how we do that and make sure we put our energies into the right sort of way. Maybe potentially using videos as well, which I think can be quite engaging.
No, thank you. And any other questions from the audience? Yes, Claudia.
Hi, Mark. You mentioned Tool Explorer. Could you give
Yes.
detail? I don't really know.
Okay, you haven't come across that?
No.
No. So it came out, it was one of the kind of pieces of work that was HEE was asked to develop on the back of the people plan, as part of the people plan. And it's an NHS Futures site, which you can subscribe to, free to access. Well, free to access. And effectively what we're doing is pulling together descriptions of roles within a particular service, so people understand what the role is, what it does, what the educational pathway is for it to get to it. So it's a little bit of there's lots of resources on there as well about implementing roles, links very much into the multi-professional team toolkit. And I'm more than happy to kind of drop you a line, Claudia, and give you a demo afterwards if that's helpful. But it's growing. It's just been launched. It's got, as I say, primary care. It's got mental health. It's going to have eye care on it and a couple of others. But we want to grow that. And to be honest with you, we want to grow its functionality as well. This is our first version of it, and we're looking for it to become a much more all singing, all dancing kind of career framework type tool.
Thank you.
Thank you.
We've got another one from Jason.
Yeah, hi Mark. Sorry, I feel like I'm hogging this a little bit, but in the absence of any questions coming forward. Yeah, off the back of Claudia's question, Mark, the Role Explorer, do you know what the intended or who the intended audience is for that piece of work? So in the back of my head, I'm thinking about some of the work the systems are doing around widening participation in young people. So, is this something that could be accessed, and is the language right for, people maybe in sixth form looking at NHS careers? Could it be adapted to that? I
mean, bear in mind that I haven't been involved in the development of it, but I'd say probably not. But I think when I look forward to that functionality, when I was talking about it as a more career framework type model, it could potentially have that within it. I can absolutely go and talk to the people who've been leading on it, Jason, and tie you in with them, so we get a proper answer to you there. But at the moment, no, I'd say it's probably, I would say in my mind, it's more employer focused.
Sure. Thank you.
Well, we've just got another one in the chat. So what is the difference between the Role Explorer and the Health Careers website?
Okay, I think, thank you. I'd say, defer you to my previous answer to my colleague, and the Roles Explorer is probably more aimed at employers, and the Career Framework site is more aimed at children, young people, and maybe not even young people who just want to come and work in the health sector and are looking to better understand the careers. So different audiences would be my simple answer to that, Sarah.
No, thank you. Any last questions? I don't think so. So thank you very much, Mark, and everybody for coming. As mentioned, we'll be circulating the recording and the slides. And yeah, if you have any other questions for Mark, please get in touch with the clear email address that's in the chat. And yeah, thank you again.
It's a pleasure. Good to see you all. Take care.